Good evening. Today is August 19, 2020, and it is 5:30 p.m. As a quorum of the board is in attendance via our video conference, I would like to call to order the meeting of the Central Health Board of Managers. The first item of business is public communication. Members of the public who wish to make comments during the public communication portion of the meeting must have registered with Central Health via the online form or by telephone no later than 4 p.m. today. Yvonne, did anyone register to make comments?
Good evening, Madam Chair. We have two members of the public who signed up to speak.
Thank you. Yvonne Dogla of the Central Health Communication Department will briefly cover the guidelines for the public communication portion of the meeting, and he will then introduce all commenters by name and invite them to speak in turn. Once you are recognized, unmute your phone or computer, state your name, and provide any comment. There is a 3-minute limit for comments per board rule. Yvonne?
Thank you, Madam Chair. To be recognized to speak, you must request a speaking slot using our public communication online registration form or by leaving a voicemail by 4 p.m. the day of the meeting. Individuals are asked their preferred language as they register to speak, and both the online form and voicemail greeting are in English and in Spanish. All speakers will be recognized by name and in the order their speaking request was received. Please keep your phone muted until you are called on to speak. Please introduce yourself by name before beginning your comments. Also, if your comments will focus on a specific item or issue on the agenda, please indicate the full item number. Each speaker will be limited to 3 minutes. Staff will be timing each speaker and will announce when a speaker has reached their time limit. To ensure the efficiency of the meeting, once we have let speakers know they've reached their limit, we will allow 30 more seconds to wrap up their comments before they are muted. Once again, speakers will be muted at 3.5 minutes to ensure the efficiency of the meeting. Speakers may not donate their time to other speakers. As a courtesy to others and to be respectful of time constraints, please try not to repeat other speakers' comments. Depending on the number of speakers and the total time being spent in the public communication portion of the meeting, the board chair may, in her discretion, impose additional limits on time or comments. Due to the restrictions of the Open Meetings Act, the board may be restricted in discussing any items that are not listed on the agenda for this meeting. The board may choose to set aside any new issues for discussion at a future meeting. With that, I'm going to call on Ms. Sharonda Robinson up to speak. Ms. Robinson, you may mute your line.
Thank you. Thank you, Madam Chair. Thank you to the board, to Mr. Giesland for the opportunity to be with you today. I'm Sharonda Robinson, and I represent the Black Leaders Collective, which is a newly formed organization of 60 Black leaders from nonprofit, public sector, private sector, and community in Travis and Williamson counties. And what the global pandemic has done for the Black community against the backdrop of the killings of Mike Ramos locally and George Floyd is made it even more important for us to continue our advocacy, but to organize together and collectively in that work. And so the Black Leaders Collective has identified 8 priority areas that we're focused on, 2 of which I want to share with you today that intersect with Central Health. The first, obviously, is, and before I say that, I would like to say that back in 2003, I was part of the team working with Clark Heydrich to ensure the passage of the Travis County Hospital District. And so I feel like this organization for me is something that's very personal because we understand the importance of public health, and particularly as it relates to the Black community. So in terms of the intersection of the Black Leaders Collective and our work, there are 2 things that I want to bring to the board and also to say to you that we are wanting to work with you to address the inequity that we see in the public health system. So as it relates to public health, what we have noticed in looking at the data and the metrics is that the numbers in terms of disparity have not changed since Central Health has been in existence. And so we see that as a failure in terms of our leadership and as also the organization to address the concerns and needs of the Black community, and particularly Black men, and in particular, Black trans women, that their health outcomes are abysmal. And the reason that Central Health is here and was created was to deal with indigent care and the care of the most vulnerable. And clearly we are not doing that because the numbers and the data show that. The second item that I'd like to highlight is economic development. That is one of our priorities. And we are deeply disturbed by the data that we see related to Central Health as it relates to contracting opportunities, the disparity in numbers, and also in terms of your hiring practices. And so again, we want to work with you. We want to be a partner and stand shoulder to shoulder with you because Black people are dying because we have failed to address these issues. So thank you. That concludes my remarks.
Thank you for being here with us today. We deeply appreciate your continued involvement and dedication to the community.
Absolutely. Good to see you, Madam Chair.
And you.
Thank you, Ms. Robinson. The next speaker is Terry Mitchell. Terry Mitchell, you may now unmute your line.
Terry, are you here? Terry Mitchell? You may need to unmute a phone line or the app on your laptop. Terry Mitchell?
I'm not seeing anyone by that name on the screen, Madam Chair.
Do we have contact information, a phone or anything?
We
or
do.
Terry?
We sent a follow-up email before this meeting.
Okay. Okay.
But be in touch with them again.
Okay. All right. Well, is there anyone else, Yvonne?
No, that concludes the public communication section of the meeting.
Okay. There could have been technical difficulties, I understand. So let us know if you do hear from Terry Mitchell.
Sounds good. Thank you.
Thank you very much. We will now proceed to the consent agenda. That concludes our public communication. Consent agenda C1, approve the minutes of the Central Health Board of Managers July 15th, 2020 regular meeting. C2, receive and ratify Central Health investments for May and June 2020. C3, discuss and take appropriate action on the extension of the agreement for disaster reimbursement consulting services between Central Health and Guidehouse, Inc. to continue services until August 31, 2020. Members, is there a motion?
Madam Chair?
Yes.
I move that we accept the consent agenda.
I second.
Okay, thank you. There is a motion by Manager Bell and a second by Manager Valadez. All in favor, aye.
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 Opposed, same sign.
Aye.
I heard one in, was there one in opposition?
No, I think it was a late aye.
Okay, thank you. So no opposition. Sometimes there's a delay, yes, with the technology. No opposed, any abstaining? Okay, thank you, members. Passes unanimously. We will now move to the regular agenda. Members, the agenda will be taken out of order this evening. Item 3 will be taken at the end of the regular agenda after item 5, just before adjournment. So the order of agenda will be 1, 2, 4, and 5 together in closed session, then item 3. We will proceed to item 1. Item 1, receive and discuss a report from the President and CEO on Central Health's current activities, operations, procurement, and workforce, including related goals and objectives. Mike Giesland will be presenting. Mr. Giesland.
Yes, thank you, Madam Chair and members. Members, the CEO's report was brought back for this meeting. It was in the July packet. And I'm going to hit the highlights, and then I'm going to show an updated workforce slide that Chair Greenberg had asked us to bring forward to the board. On workforce, what I would suggest is that on a quarterly cadence, we'll be providing the numbers as we have in the past. But in addition to that, we'll also bring forward project updates. And to the extent that we haven't set timelines yet, trying to adhere to these timelines, that are established so that we can make sure that we're maintaining progress on this front. But what I would focus on if I were in your shoes are some of the recruiting strategies that Ms. Willers has outlined in her recruiting plan, which is part of the CEO's report. And this is important because it speaks to how we will be much more deliberate in diversifying through our recruiting, but also understanding that it's not just about posting a job description, it's also about promoting Central Health as an employer and who we are at our core and our mission and how we serve Travis County and those that are under-resourced. So, I want to focus not just on the job description, but on our values and who we are as an employer. Also, watch the Equity and Inclusion Task Force. This is a staff task force, and it's comprised of a number of people from across the enterprise, and it's at the epicenter of what our cultural work is, and they will develop action plans to improve upon our workforce diversity at all levels within the organization, from the executive ranks and throughout, but also looking at, as we set value, goals and standards, what actions can we do to actually achieve those goals and standards? And so, for instance, or for example, it could be, how do we post our job descriptions in a way that is inclusive and encourages candidates from a diverse world and environment to apply for the job? So that's just one example of how this task force is going to influence our work in that. Another important element of this task force, although it's been somewhat paused due to COVID, is to go through training so that we have more people that within the organization are not just comfortable, but also deliberately able to go out and talk about race and equity issues. And this is somewhat inspired by the Courageous Conversations in the Singleton model, which some of us have attended this training, but we want to make sure that more people can attend this training and that we are able to have this dialogue internally as it directly relates to our diversity, inclusivity, and equity. Second, on the hub reports, historically underutilized business, because of the way that the contracting cycles work, we anticipate extending the annual report to a semi-annual report. So we'll provide an interim update on the numbers, but also, as we will do with the workforce, make certain that we have project updates, and those project updates will range anywhere from monthly to quarterly so that you can see the progress that we're making with respect to improving our historically underutilized business contracting. As we work through this, we have a new procurement manager. As she is coming on board, we may change that work plan somewhat as there are new ideas or maybe different directions that we need to take to improve upon it. Now, one issue related to hubs that I need to bring up that we did not discuss or put in the prior CEO report is a disparity study. In meeting with community leaders last night, but also having some discussions internally with staff and with the chair and vice chair, we need to embark on a disparity study. And I'll need to come back to the board with some recommendations on how we go about doing that. I know there's an opportunity to connect with the city and the county, but I want to make sure that we do our diligence on that and working with Lisa Owens and Perla Cavazos and others to bring back a plan of action on the disparity study and put some timelines to it. It's not just an idea or concept, but actually timeline it so that it's part of our work cycle. And then we'll need to come back with respect to how we fund the disparity study, but also perhaps fund other cultural issues, whether it relates to hub or workforce. I would now like to share a slide with you, if you'll permit me as I transition to that. Pause just a moment.
Thank you, Mr. Giesel, and thank you for your rapid movement on the disparity study, and we look forward to hearing more.
So members, can you see this slide? So Chair Greenberg, this is pursuant to a conversation that we had just recently, but within the CEO's report that was provided to you back in July, there are a number of charts and graphs that talk about turnover and recent hires, but the request was, since that is as of June 30, what the recent hires reflect if you actually pick up July through August. And this is actually through August 17. I thought it was through the first week of August, but it's through August 17. And so as you can see there, and I'll discuss the color code, and Susan, please correct me if I misstate this, but what I think is maybe a light, I'm not sure what color that is. I'm not very good with colors, but if you look on the far left, being the white category, and then the light bluish being Hispanic or Latino or Latinx, and then the third color being Black or African American. And so as you can see, in the staff category, there's a total of 8 hires, 7 of which were Hispanic. And then in the supervisor, manager, and executive positions, you had 3 hires through that time period, Black or African American. So hopefully that answers the questions about recent hires. And that concludes my presentation, but I'm happy to answer any questions. And Ms. Willers is also on the line and can provide additional feedback, as is Ms. Owens, on workforce and hub work respectively. Thank you.
Thank you, Mr. Giesland, for the updated information. I think it's important that we get timely information, so I really appreciate that. And I know that you will be coming back to us with further updates soon on disparity study and possible coordination, I know, with the city and county and AISD on that, and other updates on other activities related to disparity with hiring practices, diversity, and hub. Is that correct, Mr. Giesland?
That's correct.
Okay. And members, questions at this time? I'm scanning if I miss you. Yes, Manager Jones.
I could. Mr. Giesland, put that chart back up again. I have a question, a quick question if you can.
Yes, sir, be happy to. If you'll pause just a moment.
Okay, thanks very much. First of all, thank you for updating the information for us, and I'm glad to know this is since July, between July 1 and August 17th. Is that correct?
Yes, sir. New hires.
Okay, so you've hired within the last month or so, let's say, a significant number of staff. I see diversity there. My question is that we've done this under the gun somewhat of the issues that we've raised. What assurance do we have going forth that we won't have to continue these type of raising these issues to be able to get this type of reflective action? I'm very happy to hear that we now have a African reflective in our supervisors, our managers, and our executive over the last month, but that hasn't been the case prior to then. So what assurances do we have going forward that we'll have the same kind of equity lens in terms of outreaching and educating and recruiting for this entity?
Yes, sir. So one, as I mentioned earlier, we're going to continue to bring the quarterly workforce reports forward to you. But then in addition to that, also bring forward updates on our work activity. So as I mentioned, Ms. Willers, and there's it's not the most recent updated version, but there is a recruiting and retention strategy document that she has put together. But we're going to continue, and that's just one example, but also the work of the Equity and Inclusion Task Force. So anything that we have that touches our culture and our workforce, we're going to not just present the numbers to you, but show you what the activity is, within the organization to make sure that we're adhering to our core principles of wanting to be diverse and inclusive and equitable. And so I think if I were in your position as a board member, I would want to see the numbers, and then I would want to see progress on each of the activities. And to the extent that something is a new initiative and we launch that, then what you're wanting to look for is there a steady state operations, and is there truly a commitment to it, at the CEO level and throughout, and actually at the board level too. I mean, you all need to make sure that you maintain your level of interest and commitment to this. And so again, it's an all hands on deck. allocation of time and resources and commitment to make sure, to answer your question, that this just doesn't become a check the box exercise, because it's a cultural issue for us.
Well, that's where my question went to, is that we raised this issue. In fact, we asked that you provide it in a format that we would be able to see it by different categories. You did that,
Yes, sir.
and we're revealing, and we're very appreciative of that. Now that we go forth, I'm glad to hear we're going to do it on a quarterly basis. That's even better. Yes, you can rest assured our goal is to ensure that diversity occurs across all levels of organizations. And I think that because of the efforts that have been undertaken, we'll hopefully get there within a reasonable period of time. But thanks very much. I applaud you for the hires and the efforts you're making to diversify among all groups.
Thank you, Manager
Thank you.
Jones. Are there other,
And I'm
Yes.
sorry, Chair Greenberg, I
Yes.
left out an important
Mr.
point.
Giesen.
Last night in conversations with officials, the issue was raised about the formatting of some of this information. And Susan and I, we had the opportunity to just chat briefly about this, but we're going to circle back and look at this and maybe present some different ways to present it. Potentially, looking at EEOC reports for some design. I've already reached out to a city here within Travis County, one of the cities outside of Austin, to ask, is there, can I see what your format looks like? So we'll keep working on this format so that it's fully transparent and says who we are as an organization.
Thank you. We appreciate the increased transparency, and I know that there are, from meetings we had yesterday, some follow-up items that you and staff are swiftly working on. Are there other, I'm scanning now for other board members. I see Manager Oliver, and then I believe Manager Valadez. Manager Oliver?
Super quick question. This, I think, it just said Central Health in the slides. Is this for the entire enterprise, or is this just Central Health? And if it's just Central Health, can we see information with respect to, community care and Sendero, the full enterprise?
Yes, that slide that I showed you is just Central Health proper, so it's 120 approximately, give or take. But let me circle back around with Susan on the enterprise, unless Susan, you have a quick response to that.
I do. Based on the matrix that I provided to you all several months ago, that report is only once a year, and it happens in the month of October. It's just so much information, and it takes a lot of time to put all this together enterprise-wide and separate it by entity. Certainly, maybe we could do every 6 months if that works for the board, but right now it's scheduled on an annual basis in October.
And I remember the matrix, but I know that we talked about this. I mean, we're in August, and I know we talked in January, or no, it was even before January. I was hoping in the January meeting we could have some more information with respect to our enterprise partners on equity in pay and in diversity. And so I don't know that, and I certainly don't want to speak for the board, but I don't know that once a year is an adequate reporting for the full enterprise, especially since we're funding the majority of the enterprise.
Thank you, Manager Oliver. I have a follow-up question. I do think that I certainly would also like to see this more than annually. Ms. Willers, I understand this is a substantial undertaking. Is there staff at Community Care in Sendero who can undertake this, or is this all within your shop, which is very, very small?
Yeah, it's actually Betsy Good, and she's in the audience. We can, would twice a year be sufficient, or were you all thinking maybe 3 times a year?
Well, I think we want to see improvement. So, I mean, again, I don't want to speak for the board, but I think more frequency so that we can see if we are gaining ground. Part of the issue that I remember bringing up at the end of last year, now we're almost a year into this, is whether or not we're paying people across the enterprise a living wage. And the solution prior to this was, well, we'll give them a bump to $15 an hour, but we're going to hold that at, for 2 or 3 years. And that's just not appropriate. And that was almost a year ago we talked about it. So I want to make sure that we, as an organization and as an enterprise that is funding other organizations, are doing the right thing by the people who are working for us. And if we can't pay them a living wage, and if we're not going to be diverse in our hiring practices, then yeah, we're going to have to do a little more oversight.
So,
Yes,
Manager Oliver, if I could interject, I agree with you that we do need more frequent reporting, and just as I had requested an update for this evening, because we need that timely information. But if I could ask if maybe we let staff go back and look at the resources within Central Health and maybe elsewhere to see how frequently we could get this information in an accurate manner. Would that be sufficient, Manager Oliver, if we report back at the next meeting? Mr. Giesland, I see your hand up. Yes.
Yes, so just to make sure we're clear, for Central Health, we're talking about bringing back this data quarterly. And if I understand you correctly, for the other two pieces of the enterprise, Community Care and Sendero, you're wanting to see the same workforce data on a more frequent basis, other than just annually.
Yes,
Do I understand you correctly?
That is correct. That is
Okay.
correct. We certainly.
So, Susan, off the top of your head, do you know about the other boards for those two entities in terms of their frequency of looking at workforce data?
I know that Community Care is once a year. I don't believe that Sendero has received the Sendero board has received this type of information.
So, yeah, let us coordinate with those boards on pulling this information in more frequently, I think as a courtesy to those boards, but I certainly understand you need to be able to see the whole enterprise, not just Central Health.
Yeah,
I understand, and I do understand that they have their own independent boards, so we have to check with them because their boards have direct domain over them, and so.
yeah, but we're also in the middle of our budget season, and it would be appropriate for us to have this information as we decide where we're going to allocate resources in the coming year. And if our partners aren't going to, be responsive to what I think is an important request, and I think this is a very important request. And again, we've been asking for this for almost a year.
So let me say that, yes, we have, as I said, I completely concur that this is an important request. We want the information more frequently, but we will have to check back with those entities. But I think they should be hearing loud and clear that we want this information more frequently. Absolutely.
Manager
Absolutely.
Greenberg, may I address Manager Oliver's
Please do. Thank you. Please do.
Okay. So in April, Community Care did provide market adjustments, and during that time, they took into consideration the $15 an hour living wage adjustment. I also talked to you all about holding off on the entire study until after the compensation philosophy had been determined. And I know that through COVID, it got pushed and pushed. And I know we're getting a presentation today from Cool River. They were actually supposed to present to you all in April, but they got bumped until today. So I apologize for that. But as soon as we get this in place, we will be able to provide a more comprehensive review. In addition, we just purchased a compensation software that's going to be able to streamline some of these things that we do manually.
Thank you. I'm glad to hear about those improvements as far as our back office capacity. Manager Valadez, I think you had a question, correct? And then I see Manager Musaitif and then Manager Jones.
As one who has been, am I unmuted? Yes.
Yes, you're unmuted. I had to unmute myself.
As one who has for at least 7 years called for Central Health to participate in a disparity study, I am very thankful, Mike, that you are bringing it to the board, and I thank the board members for actually putting that at the forefront so that we can address the issue of disparities. And so that's been one of the problems. Unless we have a disparity study, we cannot be held accountable for hiring or not hiring, or putting in place or recruiting minority contractors, okay? And that was the reason I truly believe that Central Health did not previously participate when the city, the county, and the ACC participated, the school district also, in the disparity study. So I'm very thankful that we're moving forward on that. And that's going to move us, I believe. I agree with Manager Oliver that this needs to be a report that's presented to us in at least a quarterly basis. With respect to the slide that you presented, that was with respect to the new hires. I would like to see something that presents to us the context of what we are now, our workforce is looking like as it is presented to us. So you have, these are the new hires, but I want to see in the overall, what impact is the new hires having on where we are right now? Because that's what I think our community wants to know, and that's what we want to know. So,
right. And if you'll look in the July report, well, it's in this month's board packet. It has that format that Betsy and Susan have put together. I want to come back to that because I got some really good feedback last night about how to present that, and so I need to sit down with Susan and Betsy and think through how that's configured. But yes, we agree. You need to see the context of it, not just new hires, but look at the turnover.
That's right.
The reasons for the turnover and how that breaks out across race and ethnicity and gender as well.
And also, Mr. Giesel, we discussed comparing that to our patient population.
That's right.
Yes, yeah. Thank you for reminding me.
That's the demographic.
The population that we serve, not necessarily just Travis County.
Our patient population, correct.
And
I think who was next was.
I wasn't through.
I'm so sorry. It's hard with the technology. Just speak up.
I know. And so just very quickly, can I also just suggest that we also include for recruitment efforts, associations, professional associations and associations at the regional, state, and national levels as recruitment pools, especially with respect to Blacks, Latinos, Asians, et cetera, because that could be a finite population. However, if we can go outside Central Texas or outside Travis County and Austin, there may be really good candidates out there that can present to us strategies that are working in their communities that they might be able to bring to us that we could consider and implement. So if we can look at that, Susan or whoever's going to be doing the recruitment. Thank you.
Manager Valdez, that's an excellent point. In fact, that is also something that we discussed just yesterday. So thank you for bringing that to the forefront.
No problem.
Manager Musaitov, and then I believe Manager Jones.
Thank you. Can you hear me? Well, I appreciate it. First of all, I want to thank the speaker, Ms. Robinson, for coming. I really appreciate what you've said, and I echo what my other board members have said. Now, I believe in diversity and inclusion, as you can see, as a person of color and of faith, that I love representation and to be part of the table. Now, I'm having a little problem. And it is about people like me, for instance. When I go ahead and fill out an application, I fill it out as white. And what we're here addressing, and what encompasses other minorities like me. I think we want to be mindful of those minority groups. And also I would, as a person of minority and of color, I want to be hired based on my skills and credentials, and I want it to be an equitable workforce. And I love the idea that we're promoting diversity, and our board really reflects how diverse we are. I think it's one of the most diverse groups, and I hope our workforce also represents our board as well. But I want you all to be mindful of those who are within that category that are people like me that might be misplaced, or there are people who are in desperate need of employment and for opportunities. So I want us to be inclusive in that. Thank you.
Thank you, Manager Musaitov. I do think it is very important to realize that people don't just fit into little pegs, right? That we are unique individuals, and that with diversity, we have to keep all kinds of diversity in mind, the rich diversity that we have within our community. Thank you so much. Manager Jones.
Yes, I agree with most of my colleagues. I just have a couple of points. One is it conceivable that we could tie or embed in our contracts with these partner agencies this reporting requirement, as opposed to asking them, just tell them, we're like on a quarterly basis, a profile of our diversity as part of their reporting mechanism.
Is there someone
Let me
with contracting and legal who can answer that?
Yeah, I would say, conceptually, and I'll ask either Monica or John or somebody to chime in on this, but I think that there's a lot of things you can put in a contract. You can put anything in a contract. Both parties agree to it and spell out a schedule of reporting to say this is what we're going to need and the frequency of it. But having said that, I don't know if it's a separate contract or if it's part of the actual provision of services contract, but I'll defer to others on that.
I know what
Monica, can you?
Go ahead, sorry.
Monica Crowley from our staff, I think, wants to address this.
This, the Manager Jones, that's absolutely something that we can look into on the community care side in the public entity model. Because of the federally qualified health center status, it's a highly regulated status. So having the FQHC status that also gets them federal funds that are a grant for that status, the enhanced PPS rate, which is an enhanced Medicaid payment rate, and access to the 340B drug discounts. There are a lot of regulations around the composition of the board, independent decision-making of that HRSA board. And in the public entity model, there are things that we're allowed to do and things that we're not. And so I don't know either way if this is something that we would be allowed to be as directive as saying you have to report on X, Y, and Z this many times a year. But it may be something that we'd be allowed to do. It's just something I don't think that we've ever looked into before. And as we're going into this new contracting period, I think it absolutely is something that we could explore.
Thank you. I think it's thank you. I think it's a very good suggestion that Manager Jones has, and it would be good if you could pursue immediately the possibilities. Manager Jones.
Yeah, there's two other points. I know we had HRSA funding over at APH, and we used to get that kind of reporting from them. Now, I agree, they weren't FQHC, so there is a difference in terms of those requirements. But if you could look into it, I think that would be a good way to address this question. The other thing I just want to highlight, I see Miss Terry Mitchell is on there now. I know we're into discussion. I don't know if it's possible for her to speak, but I did want to acknowledge that she is on the call.
In fact, Manager Jones, I saw her too, and I was waiting for you to finish so that we could return to our public communication. Yvonne, can we return to public communication now that Terry Mitchell has been able to join us?
Absolutely. Would you have me read the
yes, I think
guidelines again?
Yes, I think we need to follow our standard procedure. So if you could do that, and then she can speak. Thank you.
Absolutely. Okay, so to be recognized to speak, you must request a speaking slot using our public communication online registration form or by leaving a voicemail by 4 p.m. the day of the meeting. Individuals are asked their preferred language as they register to speak, and both the online form and voicemail greeting are in English and in Spanish. All speakers will be recognized by name and in the order their speaking request was received. Please keep your phone muted until you are called on to speak. Please introduce yourself by name before beginning your comments. Also, if your comments will focus on a specific item or issue on the agenda, please indicate the full item number. Each speaker will be limited to 3 minutes. Staff will be timing each speaker and will announce when a speaker has reached their time limit. To ensure the efficiency of the meeting, once we have let speakers know they've reached their limit, we will allow 30 more seconds to wrap up their comments before they're muted. Once again, speakers will be muted for muted at 3.5 minutes to ensure the efficiency of the meeting. Speakers may not donate their time to other speakers. As a courtesy to others and to be respectful of time constraints, please try not to repeat other speakers' comments. Depending on the number of speakers and the total time being spent in the public communication portion of the meeting, the board chair may, in her discretion, impose additional limits or on time or comments. Due to the restrictions of the Open Meetings Act, the board may be restricted in discussing any items that are not listed on the agenda for this meeting. The board may choose to set aside any new issues for discussion at a future meeting. And with this, I will call on to Ms. Terry Mitchell to speak. Please unmute your computer. There we go.
Thank you, Ivan. Thank you so much, members of Central Health, for allowing me to speak this afternoon. My name is Terry Mitchell. I am a serial entrepreneur and investor. I'm also a social impact community leader. I've had the opportunity to work with Central Health on a few health initiatives that focus specifically on the African American community, and I'm happy and grateful for those opportunities. I come to you today as a community member. I appreciate that it's already been addressed, but one of the biggest concerns that we've had with Central Health as a community, as an African American community specifically, and for other communities of color, has been the lack of diversity, where Central Health is supposed to be the hub for that in terms of health resources. It is not only disappointing, but it truly, let's just get solution-based. It has to be cleaned up, and we all know that. I'm grateful for the strides that have been made quickly, but as Mr. Jones mentioned, it did come as almost like an expedited task to check off. And I want to make sure that whomever is placed is not only qualified, but is clear on the needs of all communities at large, but the African community specifically. And so with follow-up, I hope that the public is given information on not only continued efforts toward hiring practices, but exactly what is being done to change the trajectory of the health disparities in communities of color. And so, yeah, that's where I'm interested in seeing follow-up. This is not just about plugging and playing and just putting anything there for the sake of just shutting us up. It's about making sure that things are really done with the purpose and the mission in mind, which is to make sure that communities of low income, that normally means communities of color, get the resources that they need at high quality levels. And so this is the time to change that intentionally, not just to shut us up, not just to stop the questions, but to actually stick to the mission of what Central Health should stand for. So I thank you so much for your strides, and I look forward to the follow-up.
Thank you for taking time, and I know that you are very active in the community, so thank you for your public service and for taking the time to be here with us this evening. We deeply appreciate it, and we look forward to continuing to work with everyone. Thank you so much. Okay, members, we were on item 1. Was there any further discussion on our regular agenda item 1? Manager Musaitov.
Thank you. Mine is going to be really brief. This is not a project. This should be something embedded within our DNA. And it's not just for this time period where community members or board members have addressed this issue. This has to be authentic, well done, well thought out of, and it's going to take time. I'm not saying a solution it's going to happen in a week or a month or a year. It's going to take time to build trust and to build this authenticity that is part of who we are. And when someone sees or asks or where Central Health is, they know what Central Health stands for. So I just want us to be aware and cognizant of it. It is, yes, Ms. Mitchell, it's not a project, not a check-off box, but it is part of who we are.
Thank you, Manager. And it certainly is part of who we are. And I appreciate the comments. I know that the task force that Mr. Gieselin spoke of has been working for months, and that this is not a temporary task force, for instance. And this is a commitment to equity, to cultural change, and to this ongoing, continuing, not just effort, but implementation. Mr. Gieselin, I saw that you had your hand up. Did you wish to make a comment?
Yes, it was in response to Manager Musada's comments, and I do appreciate those, and it links back to the discussion that we just had. The Equity and Inclusion Task Force actually has its roots back to August of 2019, a year ago this year. And I remember when we pulled that group together, I said, I want to make sure we get this right, that it is genuine and that it's real. And it took us a while to get organized. We had to recruit staff people to be on it. And I wanted to make sure that that they knew that this was a safe place and that this was going to be real and meaningful work. Now, we had some disruptions because of COVID, but I'm very proud of them. They figured out how to come together in a virtual world, form task forces under Sherelle's leadership, and really start working on the work of diversity and inclusion. And one of the organizations that I came from before, it was more diverse than what we are now. The top positions in the agency were held by African Americans. And knowing that, and again, looking internally to ourselves and saying, okay, what can we do to be different? That's what launched this effort over a year ago. Manager Jones, you're absolutely right. Some of the issues that we raised here tonight were raised to us last night, but I think that's the beauty of having community partners that are willing to work with us. And as Ms. Robinson said, stand shoulder to shoulder with us, because as we get input, absolutely, let's pivot. Let's take those ideas and run with it. Because I don't want to represent that we have an exhaustive list, or that we've just thought of everything, because we haven't. And so I really appreciate this feedback from community members and board members alike. I think it's going to make us a better organization. Thank you.
Thank you, Mr. Gieselin. And I do want to underscore what you said, that we deeply appreciate the time and attention. We look forward to the ongoing collaborations, and we look forward to the expertise and guidance from those of you in the community. So thank you so much for sharing your expertise and your time with us now, and I know what will be a collaboration in the future. Thank you very much. Members, is there anything else at this time on agenda item 1? If not, we will move on to agenda item 2. Okay, I'm not seeing anything. I am scanning, but with the technology, just speak out if I miss you. Okay, members, we will move on then to agenda item number 2. Receive and discuss a presentation from Cool River Consulting regarding the establishment of peer groups to determine Central Health's compensation philosophy. Susan Willers will be presenting along with Michael Hanna and Bill Dixon of Cool River Consulting. Thank you.
Thank you, Madam Chair. And I would just like to introduce Michael Hanna and Bill Dixon to you all from Cool River Consulting. Board of Managers took a survey about a week and a half ago or 2. And tonight you will see the results of that survey, and also have some dialogue on some of the differences in the responses that were received. And then Mr. Hanna and Mr. Dixon will talk about next steps. So with that, I'll turn it over to you, Michael. Bill?
Thank you very much, Susan, and this is actually, as Susan had mentioned, our conversation has been delayed since April because of COVID, but I think, you know, it's very timely based on what we've been hearing, the passionate conversation already regarding diversity and inclusion, and how that kind of weaves into the compensation philosophy of the organization and how you want to present yourself to both current employees as well as future employees. As we dive in here, wanted to provide you all with just a very quick introduction regarding Cool River. We've been in operations since 2006, based in Austin, Texas. Our focus in partnering and engaging with organizations is entirely compensation consulting. We don't really get involved in other areas of HR. It strictly is compensation philosophy design, compensation assessments, working with organizations on their career frameworks within the organization, career mobility, and also how that ties into the various other people programs within the organization. We partner with all sizes of organizations, from small startups. We working with a small startup AI company in Austin, to Fortune 100 companies. Dell's been a client of ours for a long time, Yeti and Whole Foods here in Austin. But then we also work with oil and gas organizations, manufacturing, and then obviously nonprofits and healthcare associations as well. I've been in compensation consulting my entire life, so over 20 so years. Originally with Hewitt Associates, which are now Aon, but have been owner and started Cool River Consulting back in January of 2006. Bill, do you want to give a quick intro of yourself as well?
Yeah, I promise not to read this whole thing. I've partnered up with Michael. Michael and I worked together at Hewitt Associates many years ago. And we're collaborating on this because of my own expertise and background in tax-exempt organizations, not-for-profits, governmental organizations, and specifically healthcare. That actually is my mission and background personally, is I've been involved in healthcare since 1979 and have worked inside organizations and as a consultant for the last 34 years. So with that, I'll add commentary as we go through here and answer any questions we might have. In addition to that, I will say we appreciate being a part of this process. So thank you very much, and hopefully we can get to the end here to articulate our purpose with compensation. And I might add one point. Several times we've used the term intentional. Every organization should document why it pays people. And every organization ought to adopt and embrace their principles in doing so. Many organizations don't, quite honestly. They follow the pack. They do what others do. But it sounds to me, based on the conversation I've heard so far, that you have some different intentions that can be clearly translated into the way compensation operates. With that, Michael, take it away.
Yep, no, that's a great lead-in, Bill. And you know, this is something that organizations revisit fairly. You know, it needs to have a little bit of shelf life, but something that, you know, just from the evolution of an organization or an association, kind of dusting the comp philosophy off, revisiting it, seeing if there are any adjustments that need to be made based on where the organization's heading. For you all, it's, I think the last time that the comp philosophy was developed was back in 2007. So it has been some time. So, you know, this is a great opportunity to revisit, you know, what are some of the key compensation philosophy and guiding principles that the organization wants to have in place. The comp philosophy truly is kind of like a living thing. It's going to permeate and be the blueprint for how you design your compensation programs, how you want to recognize and reward employees, what is your employee value proposition to the organization, both for employees currently employed in Central Health, and for how you want to present yourself to the external market from an employee value proposition perspective. So each organization, there may be some similarities in terms of what they value, how they want to recognize and reward employees. But at the end of the day, it truly it needs to be aligned with your kind of overarching mission, your culture, and how you want to, and your employee demographics for the organization definitely come into play here in terms of how you want to define this philosophy. A lot of organizations also, once they have it established, actually communicate it to their employee population, to managers, when they're having a conversation with a potential applicant for a role, talking about what does the organization value and how does it recognize and reward its employees. For some public companies, they actually post their comp philosophy, or at least a section of it, out on the proxy. So it is something that isn't a lot of times held behind closed doors, but something that the organization embraces from a cultural perspective.
I have something to add that's a unique dynamic for a tax-exempt organization, particularly one like yours, is the clearest way to communicate to external stakeholders, regulators, those that examine and evaluate what you're doing from a mission standpoint. So having this written down and contemporary to what you're doing, it makes it a very reasonable link to the outside world, if you will, that might have an opinion about how Central Health operates.
Bill and Michael, sorry to interrupt, but you'll have to let us know when you want us to advance the slides. Okay.
Sure. Thanks, Susan. Yeah. And this one's good. So, the compensation philosophy at times is very kind of 50,000 foot, blue sky scenario, what the organization values. And then you start to drill into a bit more specifics in terms of tactical things within the philosophy itself. And some of those aspects we touch on in the survey that you all responded to, and really appreciate you all taking the time to do that. So we will, in this next section, touch on what were some of the key things that we heard across the respondents, and then where were there maybe some differing opinions that we want to get some additional conversation on, so that we can take this information back following this meeting and create a fairly strong draft for you all to react to. When I talk about compensation, and we've done a ton of like Comp 101s with organizations, people like to think, oh, it's compensation, it's numbers, it's an exact science. It's not an exact science. There is a science regarding how surveys are conducted, the collection of the data points and employees' pay information, and then the statistical analysis. But at the end of the day, how you look at that information and apply it to your organization, not just broadly, but to individual situations, becomes much more of an art form. And so that's something that, that's kind of one of the things that people think, that it's numbers, it's comp, it's an exact science. It is not an exact science. And there are some jobs where, they're not easily benchmarked to the external marketplace. They're unique to the organization. So it's kind of working out what makes the most sense in terms of how you want to compensate that particular role. And then there's always the balance of, okay, the market may say one thing, but internally our organization may need something different. So you use the market as a reference point, as a data point, but it shouldn't be used as an absolute. And then lastly here, this last point, there's no perfect answer to what you should pay somebody. There's a lot of different factors that come into play. When they were hired on within the organization, maybe that market was hot at that point in time for that particular skill set, or within that labor market. What geography you're in, what somebody gets paid in the Bay Area is vastly different for the same role that somebody gets paid in Oklahoma City. And then taking into consideration the individuals in a given job, what are their specific skills, their experiences, their individual performance. That there is a renewed focus on ensuring fairness within organizations on how individuals are paid. So ensuring that if there are some differences, you have some defensible reasoning for why that may be the case. And then again, there's the targets for different employee groups could be slightly different. So some of our oil and gas clients, their engineers, their geoscientists, they target pay maybe at the 75th percentile of the market, whereas the rest of the organization, it's the 50th percentile. So it's really having a good understanding of who your talent market is for the jobs. And so that's something that we're going to be talking about here this evening to get your perspectives on, so we can take that information, synthesize it into a comp philosophy statement. Before we move forward with diving into the results of the survey we distributed a week or so ago to the board, any questions, comments regarding the comp philosophy and why it's used, why you need it?
I'm not hearing any. If questions arise, managers, maybe you could note them and we'll proceed for the rest of your presentation. Thank you.
Sounds good. Let's go ahead then and dive into slide 8 here. And so what we wanted to do was share with you all the results of the survey that we distributed a week or so back, to collect some viewpoints regarding compensation and the organization, regarding the business and cultural environment that you're operating right now within, where you see things heading, some specific thoughts regarding total rewards and compensation mechanisms, and how strong should individual performance versus team and corporate performance drive pay decisions. And then also talk a little bit about, what is your peer industry? Who should you compare yourselves to the external marketplace? Because there is a difference between the type of company you are and who you compete with for talent. And I had this conversation with Yeti a year or two back when we were diving into their market and pay ranges, and they were struggling hiring people and keeping them for certain jobs in the Austin market. And as I dived into the data, what I realized was, well, they were using and looking at manufacturing industry data. And I said, time out. Who you're competing for talent in Austin is not the manufacturing companies when you're looking at your marketing and your IT jobs and your finance jobs. It's the Googles, it's the Dells, it's the organizations downtown that we need to be looking at. So those are the kind of things as a board and us partnering with you and truly delineating and defining what is and should be your comparator market from a talent perspective. And then we'll use this conversation and some of the key decisions to synthesize and build an initial draft of the comp philosophy to then share back with you all to get your reactions. So if there aren't any other questions, we'll dive into the next slide here, and regarding the actual responses to the survey questions. I think there was a total of about 15 or so that we sent out to the group. So regarding business and cultural type of topics, the board ranked your strategic priorities, which isn't very surprising, implementing a patient-focused and coordinated healthcare system. And then following that pretty much equally, developing and executing a healthcare delivery strategy, and then a sustainable financial model. Both of those kind of flip back and forth in terms of ranking. So there's very much consistency in your view and ranking of what are the most important strategic priorities for the organization kind of going forward. And that if you've got something well defined and executed, that will lead into, financial sustainability for the organization. This next question, very clear in terms of what were the top 3 important goals for the organization regarding talent. And obviously this has been a very kind of passionate conversation already with this session this evening regarding meeting diversity inclusion goals, being right up there at the very top, then finding, attracting qualified people, and then being able to retain them. Those 2 pretty much almost every organization is going to say, okay, we need something in place that we can attract, retain, develop, and engage and motivate and keep our employees. Diversity inclusion definitely has become a more and more important focus area, not just for organizations like yourselves, but for public companies and for-profit organizations as well. It's become a very hot topic for organizations. Is there a question? No, okay.
No, it's proceed.
Then this next point, desired future culture, collaborative environment was very highly ranked compared to the other options that were available. So ensuring that you promote a culture and environment where you promote teamwork, and it isn't just about the individual, but it truly is let's work together for a common mission and achieving our goals as an organization. And want to be sensitive to time with everything that you all have on your agenda here. So we'll go to the next slide. And again, I believe these materials were provided to you previously, so you can refer to them later. But we wanted to use this time to really delve into some of the questions or feedback where there may have been some differing viewpoints. In terms of challenges foreseen for overcoming and attracting talent within the organization, having a diverse workforce, again, was a topic that popped up. The history and reputation for the organization, future career growth and opportunity has really jumped up for organizations. I think we have 5 or 6 client projects going on right now regarding career frameworks, career mobilities. Okay, you've hired me into the organization for this role. What's my next step? Employees are looking for that as they come in through the door. And if you don't have that transparency built in already, that's something we definitely want to think about from an HR program perspective. And please don't hesitate as we're going through here. If you have a question or want to dive into any of these points in further detail.
Let's just keep going with the presentation. I think it's better if we hear the whole presentation, and if people have questions, if they note them. So if you could continue, please.
Sure. So let's jump to the next slide then. So this was one where there really wasn't any overarching or overwhelming trend in terms of the responses regarding current pay and performance and how closely they should be aligned. So wanted to revisit this topic with you all in terms of how strongly should pay be tied to performance, and then how much should be based on overarching central health performance versus a unit or a team, or me as an individual driving my pay opportunity within the organization. So would like to kind of dive into that a little bit more in terms of how strongly do you think that an individual's pay should be directly tied to performance, and whether it's their performance rating and that rating equates to a certain
right. So are you asking for feedback right now? Would you like to engage in that conversation now? Okay, members. So let's stop for a moment, since we have an actual point here where there didn't seem to be clear direction, is what I'm hearing. And see if board members want to comment on whether, how closely, or if pay should be tied to performance or individual performance or the goals of the organization. Is that the question before us, Michael?
Correct. It's really trying to get a good feel for how strongly, from a comp program design perspective, should corporate performance, team performance, and individual be driving pay decisions.
Okay, members, Manager Oliver.
So when I was answering this question, I mean, I look at this more from the perspective of Central Health is not a healthcare provider. So it's not a hospital, it's not a clinic. We fund things, but we are not in and of ourselves providers. So I was looking at this more of like Central Health serves like a governmental purpose and is handing out contracts. So I think that's why I was looking at this as like, I don't know that comparing it to a hospital would be appropriate. I mean, those were my thoughts on this. That, I mean, I don't think of Central Health as being a healthcare organization like I think of a hospital or a clinic or a big physicians group is a healthcare organization. Does that make sense?
No, that makes sense.
Certainly it does. It certainly does. Manager Valadez?
Yes, and with respect, thank you for the presentation so far. And with respect to the ability for us to have interaction or to respond with respect to what has been going on internally, that is just something that we have been more recently involved in.
Okay.
We were not, as a board, involved in assessing how individuals or teams internally within the Central Health Administrative Chart organization performed. We didn't know what their job responsibilities were, how important they were to the provision of the satisfaction of the patient and the other partners and the providers of healthcare. So it's been kind of, the only thing we have to look at is what we can see externally, what you can see externally, and that is the makeup of our staff. Is it reflective of our patient population? Those are the kinds of things. Is it taken into consideration culture, language, et cetera, et cetera? Those are the things that I see. But until we have something in place to be able to better assess how it works internally, that would be difficult, I think, for us to talk about.
And managers, I appreciate those comments. And for me, this is a difficult question because, of course, we have a CEO and president, and our employees are reporting to him, and I'm sure that he has performance metrics and outcomes and reviews. But I think what you're asking us for is putting that aside. What do we personally think about compensation? And we're not a company that is manufacturing and has employees who are in sales, for instance, right, where you would tie something to their individual sales performance. That's not who or what we are. So I think it is somewhat difficult to you want employees to take ownership, right? You want a collaborative culture, but you want employees also to take ownership. And so how do you balance that with an entity that has community-wide goals and that takes everyone really working together to achieve those goals? Right. Is there someone we have not heard from yet? Managers, I'm looking. Yes, Manager Zuniga, please.
I was a little conflicted about for performance. I think we've already kind of talked about it. And the way I was thinking about was pay for performance, as in what are the patient's outcomes, like you paid based on what the patient's outcomes are. And that's kind of hard for different people to control, especially since this patient population. And what were those measures? And it just seemed too vague for me to be able to give a really solid response. So it seemed like if we're going to pay patients, pay our staff based on the patient's performance, it felt uncomfortable. I don't know if anybody else interpreted it that way.
Manager, let's see, are there any managers that we haven't heard from yet? And if I miss you, I'm scanning, then please just shout out. I'm not seeing any. Manager Valdez, did you have another question?
Just one last thing. Now, the one thing that we are responsible for is the MAP population and filling and seeing who is eligible for our medical assistance program. And that is a direct provision of who is eligible for direct provision of services, medical services and medications based on their diagnoses. That is our responsibility. And that has always, for me, been one of the priorities that we really need to be able to evaluate ourselves on. Have we increased the patient population? We know that there's almost 200,000 people in Travis County that do not have insurance. Yet for eligibility requirements, you know, we have had some limiting factors that we as a board have had to contractual issues we've had to deal with. But as we're moving forward, we need to be able to put something in place that's going to decrease that uninsured, inaccessibility to healthcare. And that is what we need to tie. I think that's a very important, and one of the most important things that we can do is tie that to patient satisfaction as we are trying to get people qualified for
Thank you.
insurance.
So I think this highlights the difficulties that we're talking about with an organization that, as Manager Oliver pointed out, we do a lot of what we do is funding of other entities. We do have some responsibilities that are not just funding, but even if we're funding and we're contracting out, we have outcome measures and performance measures that we are looking to improve. But I think, again, this highlights the difficulty in outcome and performance measures for the organization and for our patient population, where we want to see improvements in their health outcomes, versus what you're asking, which is tying pay for employees to either individual performance or this performance of the organization as a whole, or some combination.
Correct.
And it's
Chairperson?
yes, Manager Jones. Yes, please.
I'd like to go to that last point you were just making, because I agree with what everyone else is saying with regards to the pay for performance directly linked to our staff. But I do think there's some correlation in terms of Central Health's role and knowledge, accessibility, and accountability to the taxpayer, and tying that to performance. I mean, we take the taxpayer dollars with the expectation that outcomes will occur. And if that is not occurring, somehow or the other, is there a way to assess that in terms of performance, either ongoing pay increases for executives and others, or reporting mechanism that help us to determine what we have to do as a board? I just think that we need to look at that, at least that element of it, to see if there is some correlation we can make.
Exactly. That's why I was mentioning the performance measures and the outcome measures. And so, yes, how would we tie some measure of individual responsibility to the collaborative responsibility and collective responsibility of the organization for those performance measures and those outcome measures? Exactly, Manager Jones. Thank you. Do you need more conversation? Or are we ready to move on?
That was very helpful.
Okay, let's continue then.
Let's keep moving.
Yes,
Madam
please.
Chair.
Yes, Mr.
Madam Chair,
Geisler.
I'm sorry. And I want to apologize. My computer was frozen, and so we're having some internet stability issues here.
Right.
The Cesar Chavez building, but I think some of you were trying to address this, but I want to make sure that the board understands. In addition to contracts, we're running a healthcare program, a comprehensive healthcare program, and building upon our systems through an equity lens to build something out that is, first of all, it provides hundreds of thousands of health encounters a year. but something that is, year over year, we're improving upon. And so, in addition to the contracts, as part of that system, it's also eligibility and enrollment, it's communications and outreach. It's the operational support for 2 other companies within the enterprise. That would be joint tech, facilities management, financing, HR support, strategic planning. And so there's a lot of different things that we do that, yes, we are a government agency, and Manager Oliver's right. That's technically our industry classification. But when you step back and look at us as a healthcare district, especially compared to other healthcare districts, if you think back to the performance report, we are really a unique entity and organization. And so I appreciate this conversation, but I needed, and again, I apologize for the internet connectivity issues, but I wanted to make sure we got out there and really talked about who we are and what all we're doing and will continue to do. Thank you very much, members, for indulging. Appreciate it.
Could I interject?
Thank you.
Senator Greenberg, just to respond.
What?
May I interject just a moment just to respond to that?
Of course, Manager Oliver. Yes, please do.
So, in reading, the survey that was sent out to us, I did find it interesting that Central Health considered themselves, in the League of Healthcare Providers. We are not like other healthcare districts because we do not have a hospital.
That's right.
And, when I think about what Central Health does, we fund things. We do. We support healthcare operations. But I think that's also what a government's function is. They support things and fund things at a governmental level. But that doesn't mean that, for example, the city of Austin is in the roads business because they fund roads here. So I don't know, maybe Mike and I have a different view of what Central Health does. I get what community care does. And I get that we're changing things, but right now we still do not provide healthcare delivery. Central Health does not provide the delivery of healthcare services. We fund partners that do that work.
Well, I'd be curious as to the board's views on, for example, like our care management programs and our post-acute care programs that we manage.
Well, that's what I said. It's changing.
Where does that fall?
It's changing, but I wouldn't say that puts you in the level of, a healthcare delivery organization, again, like a hospital. It just doesn't.
So I would say that Manager Oliver, you hit on something, which is it's changing, and that we are a combination now and have been moving in various ways with some legislation that passed last session and some things we've implemented to a more of a combination of these two. But I appreciate the dialogue. Members, is there anything else before we continue with this presentation? It's certainly, we are unique. We have various aspects that you see in other organizations, and we are changing and evolving, as I said, with some of the legislation from last session and things that have been implemented. We certainly do have staff, though, that we have to have expertise in healthcare to oversee, and I think this is one of the things that Mr. Giesel was saying, to oversee contracts and other things. Is there anything else, or should we continue with the slides? I'm not seeing anything. Let's continue with the slides, and if you have questions, just note them, okay?
I just had one comment to make as a follow-up.
Okay.
Okay, and that is taking that what Manager Oliver and what our CEO Mike Giesman have said. It is another, I would think, Central Health responsibility to make sure that our partners are providing the services that they should be providing, so that we're not the ones that have to step in to do their jobs for them. And that is going to be taxing on our budgets. And what we have to put in place is something that will hold our partners in the provision of services to the population that impacts their health care or their health or their quality of life, to be held accountable for providing that services. Again, that we have to put something in place that will force them to do that, and not just say, okay, if you're not doing it, well, we'll do it. No.
And that's why we need, as we were talking about, and I think as Mr. Giesel was mentioning, staff with that kind of expertise. Okay, members, let's keep moving. If you have other questions, let's write them down and note them as we move through the presentation, unless our presenters have another spot where they particularly need our comment.
I think we can continue on here. So very quickly, this next topic, internal equity focus versus externally competitive, definitely, obviously a strong focus on internal equity. Through this conversation, I think, and you all have talked about this earlier in the session today, having more regular reporting and analysis and analytics on trends of where you're hiring people, where you're losing them to, looking at the internal equity and how you're paying your employees, what are the hiring practices, the promotion practices, definitely things that require doing some rolling up the sleeves and looking at the information to make some, to glean some insights and make some decisions off of. Let's jump to the next slide here. So in terms of factors that should be valued and rewarded in pay and promotion actions, individual performance ranked at the very top with skill development and tenure, falling low there, which is, I think a very important thing to think about when we're talking about the compensation philosophy, that, promotions opportunity, career progression, definitely going to be driven by an individual's performance and consistent performance and skill development within the organization going forward. So I think the key is ensuring you've got programs and processes in place to help facilitate those decisions and ensuring that the right people are moving appropriately through the organization at the right time. And ensuring that you are able to identify within your performance management and promotion process who that top talent truly is within the organization. Regarding emphasis of corporate versus individual results, this kind of ties back to our pay for performance conversation earlier, a slight leaning towards the individual results. But very close, almost 50-50 kind of distribution there. So, when we think about the comp philosophy and your comp programs, having a balance of, okay, we're creating this collaborative environment. We're all focused on these overarching values and mission, but also having some levers in place to recognize and reward your star performers where it makes sense from a compensation perspective. Let's jump to slide 13. Thank you very much. So regarding pay position to the market, this is a conversation that you always have with organizations on how do you want to position your pay to the external marketplace. Pretty much most everybody's kind of in the terms of the responses, 60-40 split on 50th percentile for executive management, your tech and office kind of G&A type jobs. Where potentially, looking above market pay for your clinical staff, and then a very strong leaning to 50th percentile for your admin and support roles. So I think, having some type of statement within your philosophy that and weaving in some of these conversations regarding pay for performance, corporate versus individual, that we as an organization want to ensure we're competitive from a pay perspective, targeting 50th median percentile, but for consistent top performers in our organization, providing above 50th pay opportunity as well as career advancement opportunity within the organization. Geographic labor market, this trend is very consistent for all types of organizations. Your lower level kind of admin support types of roles, you're typically pulling them from the local labor market, wherever you're geographically located. And then as you go up the organization into your professional management and then your executive, that's where you start looking at more of a regional and or national market for pulling talent. So this is definitely a trend that is not unique to your organization. Let's jump to slide 14 here. So we've touched on this a little bit regarding who you all should compare from a talent and pay perspective. Health plans, were ranked as #1 by most of the board members. Hospitals behind that. Some additional sectors mentioned were health districts and retailers and distributors. So it's kind of a mixed bag here. And again, I think it really kind of comes down to doing some analytics in terms of, okay, over the past 12 to 18 months, where have you been pulling your talent for the various types of roles within your organization, whether it's professional technical, whether it's the clinical, whether it's management, and where are you seeing success of people from those types of organizations or sectors really excelling and embracing your mission and the organization and thriving. Definitely something to take a look at in terms of how we want to define who you compete with from a talent perspective. And then here are a few peers that were specifically identified within the organization. From a pay competitiveness perspective, about half of the respondents, or right at half respondents, said, base pay, highly competitive to moderately competitive, with the benefits provided by the organization dropping down a bit from there. Let's jump to slide 15. And then in terms of, and this fairly consistent in terms of the responses being provided, having a program that is consistent in its program application to the organization, where you're driving internal equity and fairness within the company, but having a program that's flexible to allow and recognize for maybe some of the unique skills or roles that you have, because every role isn't created exactly the same. So having a program that drives consistency in application across the organization, but allows for some flexibility where if a hot skill pops up or a particular role that's just the talent opportunity is just limited, providing you the opportunity and the levers in the program to accommodate those unique needs. But again, some very consistent responses here regarding, ultimately what your compensation program should look like within the organization. And so the last slide 16, just outlines kind of next steps here. I know, unfortunately, gone a little bit over, but basically, what we'll do is utilize some of the feedback we received here today, as well as the trends and key themes we saw from the survey responses, to develop an initial draft for your compensation philosophy moving forward. Test and validate that draft compensation philosophy with you all, and then finalize it. And then again, that does become kind of your blueprint for your various HR programs, whether it's your base salary design, how you benchmark to the external market, performance management. You'll want to kind of pressure test your current programs with your compensation philosophy to see, are there some adjustments to the current methodology and approach that needs to be made on a go-forward basis to truly support that newly defined comp philosophy.
Thank you very much. Ms. Willers, is there anything else that you wanted to add?
No, thank you all so much. Thank you, Michael and Bill.
We really appreciate your time this evening. Thank you very much.
Thank you. Very thorough presentation. Members, is there anything else? If not, we'll move on to our next item. What is the timeline in which we should anticipate this draft that you were referring to?
So we'll target probably getting you all an initial draft in mid-September.
Okay.
So after Labor Day weekend, we'll develop something, test it with Susan, and then based on her feedback, refine it a little bit more, and then get it in front of the group here.
Thank you. Thank you very much. Members, anything else? Scanning and not seeing any. So we will then move on to items 4 and 5. Item number 4. Sorry if you hear background noise. My youngest child. Bert is his name, the dog. Okay, so number 4. Receive and discuss updates on the 1115 Medicaid waiver, delivery system reform incentives, payment, DSRIP, close projects, and the Community Care Collaborative, including healthcare delivery arrangements and any other community partnerships. And then number 5, receive and discuss an update regarding Sendero Health Plans, Inc., including the effect of federal legislative and regulatory actions and the creation of a new line of business beyond healthcare coverage benefits. Members, I announce that the board is convening.
Madam Chair.
Yes.
Madam Chair, I'm just asking, I know you announced it earlier, is there any way we could put item 3 now and leave the last 2 for a closed session and just come back and close after that?
I've been advised that there are some reasons that we need to adhere to this order.
Okay, all right then. I was just trying to expedite.
I completely understand that, but I've been advised that there's some reasons that we need to adhere to this order, Manager Jones.
Okay, all right then.
I announce that the board is convening in closed session to discuss agenda items 4 and 5 under Texas Government Code Section 551.071, consultation with attorney, and Section 551.085, governing board of certain providers of healthcare services. So managers, everyone will need to get completely off of this line, I will call it, and you should have received instruction, Perla or Brianna is correct, to get on a separate line for the closed session?
Correct.
Yes? Okay.
Yes.
I will see you there, members, and thank you everyone for participating, and we will be back. Perla, David, can somebody let me know when we're ready to go with whatever quorum and recording technology we need and whatnot?
Yes, I'm counting board managers.
Right. And then whatever technology we need to have in place.
We have 5 board managers.
Okay, so we'll, okay, so it is
right.
Wednesday Thank you very much. It's Wednesday, August 19th, and I am announcing that we are out of closed session. We are reconvening in open session. There are no motions necessary on items 4 or items 5, so we will now move to agenda item number 3, receive and discuss a presentation on the proposed Central Health and Community Care Collaborative fiscal year 2021 budgets, including related strategic objectives and fiscal year 2020 end-of-year estimates. Jeff Knodel, Lisa Owens, and John Morgan will be presenting. Managers, it is my understanding that the Community Care Collaborative budget is not going to be presented this evening. I'll let our staff please proceed with your presentation. Thank you.
Thank you, Chair. Jeff Knodel, Chief Financial Officer. And yes, you are correct. We are only presenting the Central Health proposed fiscal year 21 budget. We did a presentation last month. We have not had a lot of significant changes, but we will walk through those changes with you. One event that's occurred is we receive our certified tax roll and we set our rate. So we have received that information. We're not asking for any action tonight. This is still one of the many informative meetings that we will have. We will come back next week though, and next week is our meeting to set our maximum tax rate. I'd like to thank board members that have reached out, and we've met with some board members. We've answered questions and received comments regarding the proposed budget. So thank you for reaching out. Appreciate all the questions and input. I'd also like to mention that our budget process has included input from almost 400 community members so far, which is a 33% increase from last year. We will be providing details of the input report, and they will be made available to the board very soon. I think it's in the process of being developed, and we should have it in the next day or so.
Thank you, and I'm pleased to hear of the increase in participation from the community. Thank you very much.
Right, thank you. Yeah. Next slide. So the next slide is our, I mentioned we've received our certified tax roll, and we've calculated our proposed tax rate at 6.9% over the no new revenue rate. So you see the historic tax rate on the red line, the historic year-over-year change for the taxable assessed value. And just as a reminder, we've calculated the rate at 6.9%. Remember, we initially had a rate of 6.5% that we were going to prepare for the proposed budget. We've increased it correspondingly by 0.4%, which equates to about $875,000, and that's directly linked to our community investment fund, and we'll go over the detail on that. Just one more factoid is the taxable assessed value growth from, and again, these are tax years, from tax year 2019 to 2020 is 4.24%. So a little bit less than we've seen in previous years, but nonetheless a significant increase. Next slide. So this is our kind of a combination of our some tax rate information and then our taxpayer impact statement. So if you look to the bottom right-hand corner, you see our proposed rate for fiscal year 21 is 11.0306 cents per $100 of taxable value. That rate's made up of two components, maintenance and operations, which is the majority, a significant part of the tax rate. Of the 11 cents, 10.9717 cents is the maintenance and operations rate. And then debt service is 0.0578 cents. So total rate of 11.0306 cents. If you look at the average taxable homestead value, the difference between fiscal year 20 and 21, you see the two columns there. And our annual increase at this taxable value is $25.37. And then you see in the big table above are the tax bands that we look at on our taxpayer impact statement. These bands represent approximately 88% of the total homestead taxable value in Travis County. And you see the range of those increases is anywhere from $10 for the lower band up to $30 on the upper band, which is a homestead value of $440,000. So keep in mind that Central Health does maintain a 20% homestead exemption, which is the maximum amount for that local exemption as allowed by law. Next slide, please. So we've updated our 7-year forecast to reflect updated numbers. Chart represents 6.9% over the no new revenue rate year over year. The key metric the key graphic to really keep focus on is the gray line, which are total reserves. And the gray line shows the total reserves and the amounts over our emergency reserve, which is is used for emergency situations and per our financial policy would be our last resort for funding. The other metric on the table below to focus on would be days of cash on hand. So you'll notice that in fiscal year 21, that's our high point of days of cash on hand. And given the funding, known funding events that we know are around the 1115 waiver and specifically around the DESRIP program, we expect to see a reduction in days of cash on hand as that program unwinds. We did not forecast a supplemental or a replacement program that would replace DESRIP in the out years or the future years. And you'll see that the trend is the trend that we would want to see, which is, yes, we have a higher level of days of cash on hand, or our reserve levels are higher. Initially, we would expect to see a decline, but in the out years, the very far right-hand portion of the graph, as we move into fiscal year 26 and 27, the line starts trending up and we begin replenishing our days of cash on hand and our reserves increase. Next slide. Well, we talked about this and had this slide at our last presentation. I'm going to go over it a little bit quicker, but it is an important slide as we talk about reserves and long-term forecasting of those reserves, that we always keep in mind of the risk associated with organizations like ourselves around delivering healthcare. COVID-19 has certainly been, community care has been a really big participant in testing and contact tracing. We don't know how long that COVID-19, especially the emergency declaration, continues. Certainly a risk, and associated with that is also ongoing provider revenue loss. So providers are providing services. There's still limitations on full capacity of providing those services and bringing in the revenue associated with those services. In our budget, you'll see a hospital services line. There, as we've contemplated moving into our model, there are a lot of risk assumed with that model. We currently have a MAP member risk around population acuity, the cost, pandemics, regulatory issues, et cetera, et cetera. Currently, we don't hold the hospital risk around that area. As we look at the potential of moving into more of a hospital-based model, we may assume more of those costs, and they could certainly be much greater and much more volatile in a hospital environment. And then secondly is just administration of any new agreement, the risk and the cost around administering that agreement. Another risk to be really cognizant of is just the funding required to adequately improve our gaps in our system of care. We've been talking about our system of care in our strategic planning meetings, and have identified a number of areas that improvements are needed, and just looking at the amount that would be required to improve those gaps and develop a prioritization process in order to remedy some of those inadequacies. We've talked a little bit about the 1115 waiver in the preceding slide. Just there's still a risk associated with desert performance. I don't know if you recollect, board members, but when this phase of the desert projects began, we established baselines, and we had to develop incremental improvements. And initially, the improvements are much easier in the beginning. They get much more difficult as ongoing as the desert waiver period progresses. So there's always a risk that something unforeseen could happen. COVID-19 is a great example, and it may inhibit or inhibit our actual payment for performance related around those projects. Discontinuance of the Affordable Care Act is always a risk. We've estimated there are at least 25,000 ACA members in Travis County that are at or below 200% FPL, and we would sense that a lot of those, if that program were discontinued through the court system, that would certainly increase the population that would be eligible for our MAP and MAP basic programs. And then the EPIC implementation. This is the electronic health records system that Community Care is implementing. This is a major system. It's their major lifeblood of their data. And certainly having a successful implementation is key for continuing progress and success in delivering healthcare for our patients. So that's a failed implementation is a major risk. taking these risks and others that we either know about or don't know about is critical that Central Health maintain reserve levels to ensure the ongoing provision of care and the mitigation of any known or unknown risk. So next slide, please. So I'm going to turn it over to Lisa to continue the presentation.
Okay. Thank you, Jeff.
Thank you. Can you hear me okay?
Yes.
Okay, great. Thank you, everyone. I'm going to present some highlights and try to move a little quickly through this information to give you time to discuss. We did present a draft budget on July 15th that was a little early. And as Jeff mentioned, we have since received additional information from TCAD and made some adjustments, but just wanted to hit the highlights of what's in the budget. As you remember from our strategic planning committees, our budget conversations, the work that's in this budget, we believe supports our strategic priorities, and it also includes investments in these following key areas. So it does support the Access to Care initiatives that we've been talking about, as well as the system of care that was presented by my colleagues at previous meetings. As Jeff mentioned, continued planning for hospital funding model. As Mr. Gieslin has shared with you in a previous meeting, we do have some funds in there and a corresponding tax rate increase for a community healthcare investment fund. We also have increased funding to support ACA high risk premium, continuing to support that EHR implementation that Jeff mentioned. And then of course, our capital planning. We have some reserves additionally allocated this year. I have more information on our capital planning later in the presentation. And also just to highlight that this year we did implement a business case process internally. It was outlined earlier this fiscal year by Mr. Gieslin. In April and May, business cases were submitted for additional investments and support in the budget. The business cases were reviewed by a group of management and discussed. It was a very thorough process. And then those business cases that were advanced were included in the budget. And so the internal committees and internal process was thoroughly used to incorporate those. I want to talk through tonight a little bit more detail that we presented last meeting, and that really is in our larger operating departments, which is where many of those business cases, if not all of them, are coming into the budget dollars. So we've tried to provide a little bit more information. Our healthcare operations are a very big part of what we do, the work that supports implementing the care that's delivered, supporting the agreements we have, ensuring that our analytics and reporting is running smoothly, as well as our health information technology. And so I'll just highlight a few of, there's 13 business cases incorporated into this, as well as just incremental growth or changing departmental needs. And so some of those you've already talked through at length as a board. If you notice an additional 9 FTEs, an additional budget in the eligibility and enrollment, that's for the call center that you've been presented. There's operational savings on that where those dollars would not be a contracted service. Another business case that was presented in advance was to lift up an additional patient care management team in our patient care management department that would provide the patient care management similar to our staff currently. With an entire new team would be able to support an additional cohort or group of patients. Other business cases really looked at bringing contracted services in-house in some cases, and especially in the administration area, we had a couple additional FTEs that would be added where contracted services would be reduced. And then finally, we also, as we have changed over this past year, we continue to change and grow to meet the needs of the work that we're doing as our work expands. We have seen a little bit of a shift from roles and responsibilities. So for example, where you see that -1 in administration, there were some staff that are now doing healthcare operations and their positions were realigned. And an example of that would be in our analytics and reporting. Some staff were moved out of the strategy department and into the analytics and reporting. So there were some extensive looks at our operations as we move forward. So this presents more information. I think you're used to seeing some of these departments, and we wanted to just be able to highlight how that business case process was advanced into budgeted initiatives for consideration in the proposed budget. I'm going to turn it over to John Morgan to just briefly go through this information about service expansions, especially in specialty care.
Good evening. Manager Greenberg, can you hear me okay?
Yes, thank you.
Great, thank you, ma'am. Members, thank you for your time this evening. I'll try to be brief. I know we're getting pretty late, and most of this information you've heard before in previous board and committee meetings, so I just want to hit a few highlights this evening, and of course, I'm happy to answer any questions along with Jeff and Lisa at the end of the presentation. As a brief reminder, this slide highlights some of the new healthcare delivery initiatives and the proposed service expansions for the upcoming year. Tonight, we've included some additional detail on the proposed amounts that are associated with each of these initiatives. I should also mention that because many of these are new initiatives or service lines that we are continuing to expand over time, the dollar amounts for each of these is likely to grow in the future as the services continue to ramp up. So in some cases, these are the incremental additions to service lines that existed previously. In others, these are what we would refer to as a starter budget if we're introducing a new service in our network. While a lot of these initiatives are listed separately, tonight I really wanted to hone in on emphasizing that many of these are actually connected in a lot of cases. Many of you heard from our Dell Medical School colleague, Dr. Deepak Agrawal, at one of the recent strategic planning meetings. That's where he walked through, for us, the efforts of his school as well as at community care and their work to eliminate our gastroenterology wait list over the past year. A lot of what you see here on this slide is our effort to replicate that model that generated our recent successes in GI. Just to orient you to the left side of this screen, the services on the left side, 4 of the first 5 items on the left-hand side of the chart represent our planned initiatives to expand existing specialty care service lines, working primarily with community care, but also with a few of our other provider partners in the community. Community care, as you all likely know, has provided a significant portion of the endocrinology and cardiology services for our patients for quite some time. Podiatry and rheumatology were recently added over the past year or two at community care, and we're continuing to ramp up those services. Neurology, we're very excited about, is a new service area that we're exploring that we have not historically approached, but it's one where we've seen demand continue to grow and exceed the capacity in our system. I should note that neurology is pretty early in discussions. We've never recruited or hired a neurologist. Community care hasn't. And that's still, a large part of our discussions with community care. Our contracting discussions likely still subject to their board's approval as well as HRSA approval. So that's where, when I was saying we have starter budgets, it'll likely take us, working together over the next 3 to 6 months to put all the pieces in place to build a neurology service from scratch. So there's a lot that really goes into that. I mentioned earlier that many of these initiatives are connected. I'd orient you to the right side of the chart, the last two items in particular, referral management and patient navigation, as well as telemedicine and e-consult services. We certainly can't provide expanded specialty care without our physician specialists, but it's really the addition of the non-physician care team members and the support operations that manage what happens outside of that physician visit that allowed Dr. Agrawal and his team to work through our significant GI wait list in a fairly short period of time. Things like referral management, patient navigation, e-consults, they're often overlooked or thought of as an addition, an add-on. But these are often what we need to simultaneously build capacity and also make the different pieces of our specialty care system come together and work for our patients. Just briefly moving back to the left-hand side of the screen, the last two items, psychiatry and substance use consists of enhancing the availability of our behavioral health services that are integrated into our primary care settings, as well as expanding on our substance use program that we've had underway for 2 years now, and making that service available across our primary care settings. Finally, you've heard me talk a little bit about dialysis. This is a new area for our team that they're really building from the ground up. Today, our MAP patients unfortunately only have access to dialysis services in the hospital when it's an emergency, and we really want to fix that this year. A lot of pieces have to come together there. There is not a system of care around dialysis for our patients today, and our team's hard at work to put that into play based on the board's approval. Dialysis program for us, can really help move services out of the hospital that don't need to be there, while we also improve the health of our patients and even help those individuals live longer lives. I will call out one other area, which is the neck and back pain and bone health, as well as the ambulatory surgery center services. This is what I hope is the first of many service expansions this year with our partners at the Dell Medical School. There are several other areas that we are looking at and exploring with the medical school leadership, including the professional and surgery center components related to ophthalmology, gastroenterology, so additional colonoscopies, cancer screenings, women's health surgeries, and also general musculoskeletal services. I will turn it back over, but I look forward to helping answer any questions.
Thank you.
All right, thank you, John. So just briefly, what we provided you in the information that you received, as well as I'll walk through quickly here, is just a variance of what we presented in July versus now. So the variance column, just to orient you, does show the change in the presentations, not the change from 20 to 21, FY20 to 21. So again, we did receive the certified roll. After updating the numbers, the tax rate was able to be calculated. The no new revenue rate was our starting point, and then 6.9% over that, as Jeff mentioned. So we have an accurate tax rate based on that certified roll, and then the calculated revenue, which did go down just a little bit based on the early estimates from April. And then we also made some adjustments on the uses. Again, as planning continues and time goes by, we did, in conversations about some specialty care, make additional increases in that area. We also increased some possible expenditures that may be required in healthcare facilities to support the EHR initiative, and staff that will be working on the EHR in the implementation phase will be capitalized, and so made some adjustments there. And then just some minor adjustments to information as we kept moving through the process, additional funds and salaries and benefits to potentially support what comes out of the compensation work that the board is doing on the philosophy or market adjustments. And those changes are all outlined in the line items there, again, showing you the variance between the two presentations. And this has not changed. I will walk you through just this is our reserves. Now this is cash reserves that we will have on hand that we think at the end of the year. Anticipated capital expenses in Eastern Travis County or clinical service expansion, campus redevelop, the Red River alignment, and then other capital projects, which would include the investment in the EHR and other infrastructure projects or facility costs at other facilities. Some of that would be cash funded through the existing reserves or additional reserves being allocated in FY21, and some could be debt financed. So this is an estimate of that information. Again, no changes since July. An update then on the process going forward. We will be back next week. We will be going to Commissioner's Court on Tuesday to present our proposed budget, but really wanted to just point out a couple highlights in the changes to the calendar this year as a result of, I believe, SB2 and some regulatory or some requirements changes. We will only have we are only required and will have one public hearing. So next week, we anticipate setting the maximum tax rate. We then will have a community conversation. I look forward to you reading the community engagement report that will be shared with you for next week's meeting, and we'll talk more about that. We had a really robust community engagement from our partners on the outreach and engagement team, as well as earlier community conversations this year. We will have another community conversation with a more specific budget next week. And then we will also have a public input session. We will have an opportunity for the public, but our public hearing that is required will be on September 9th. So we have ample opportunities, we believe, for input from the community going forward as these numbers come together, but that official public hearing will be on September 9th. And we are still working on the logistics of that. It's my understanding we will have an in-person opportunity for those who would like to come to a facility to provide public input. And then finally, we would reconvene with you and anticipate adopting the tax rate and the budget on the September 16th date, and then return to the Commissioner's Court September 22nd for that final tax rate adoption and anticipated budget approval from the Commissioner's Court. So again, we're happy to answer any questions. I know we've shared a lot of this information with you last month and now, and I really hope you had time to look through it over the past month and just let us know what questions that John, Jeff, or anyone can answer for you.
Thank you all for that very thorough presentation and the updates, and thank you to the board members for getting with staff and getting their questions. Do we have questions at this time? I am trying to scan here to see if we have any questions at this time. Manager Bell, are you there?
Can you remove the
just a minute, Manager Jones. Manager Bell, did you have a question?
No, I did not. Thanks.
Okay, Manager Jones.
Yes, could you remove the sharing? Well, on second thought, leave it there. My first question, I just have a couple of questions. One is, have we ever estimated the amount of revenue from homestead exemptions that are not coming through and that are not available for the district? And have we done it either by categories, in other words, those classifications, particularly at the higher levels, meaning $550,000 homes or above? Do we have any figures of what that might look like?
Are you
Jeff,
referring to the number of homes or the value of those
the values that are of those homes times the number of homes to give us potential revenue that is being derived, that's not being derived because of homestead exemption. Is that figure anywhere available?
So I think we could take a stab at that. I would say, what is it costing you? It's costing you 20% of, assuming the tax rate. Now, here's where it gets a little tricky in that calculation. So we offer a homestead exemption of 20%, and we set our tax rate appropriately. And so you could argue that as a whole, homesteads are getting a 20% discount as a result of that homestead exemption. So if you want to look at it as a whole, it'd be a lot harder to calculate because we would calculate our tax rate based on an aggregate revenue number. And if we didn't have that exemption, we would just set the rate. It would get diluted across homestead and non-homestead classes. But if you wanted a simple calculation, Manager Jones, of by tax band, what's the revenue loss based on the 20% exemption, we can do that relatively easy.
Yeah, particularly for those bands that are 450,000 and above.
Okay.
Okay.
Sure. So, but I just want to make it clear that it's a more comprehensive, when we look at our tax rate and our tax revenue, homesteads are just part of our the totality of our taxable base. So
right. No, I understand that. I was just looking at, particularly in certain parts of the county where we know high value homesteads. What does that look like? Is what I was trying to get.
Yes. Okay. We can get that number for you.
Okay. And then the only other, just one other quick question is, do we have any time frames? And I think I know the answer, but I'd just like to look at that in terms of projection for those facilities that we're looking at in the eastern Travis County, in terms of building into our calculus, particularly Colony Park and Dell Valley. And I know you may not have an answer, but do we calculate in terms of capital of what we anticipate this year to be put aside or made available for that?
Lisa, can you respond to that?
Sure. I don't have specific sites as there's not an explicit project that's been approved yet, but we did anticipate that we might have, and I can go back, I have a long-term slide that you saw last month, that we may start 2 to 3 clinics, and the timing on that would go into FY 22 on some of those. So I can give you a little bit more of the math on how we did the longer term projection, but we had for the 2 to 3 clinics that we put into the capital planning, we spread that over a 2-year period, knowing that they won't all start on the same day and they won't all, end at the same time. And so it is blended that some of those would start this year and end next year. And then
that's what I was looking for.
Finish.
Yeah, that's what I was looking for.
Thank you.
Thank you.
Manager,
that's my questions.
Thank you, Manager Jones. Managers, any other questions? Manager Musaitov?
Yes. Can you hear me? Okay. Just want to make sure. Well, mine is really more of a comment. I want to congratulate the finance team on a well-received award, on really earning the Distinguished Budget Presentation Award from the Government Finance Officers for fiscal year 20 budget. Thank you, Lisa, Jeff, and everyone on the team for doing an instrumental job. Appreciate you. Thank you.
Thank you. I'm glad that you recognized that I was going to. So thank you, Manager Musaitov. And it was something that had suggested a couple of years ago, and they managed to achieve it. Of course, finance staff, you know that next I will be going for the award for our CAFR, our Comprehensive Annual Financial Report, right? I know we can get there, and congratulations.
Yes.
Anything else, members? Again, if I miss you as I'm scanning, just speak up.
Just two quick questions.
Yes.
If someone can tell me whether or not they followed up on getting that information regarding Epic that I had. And if you haven't gotten it yet, if you can just call me and let me know when you do get it.
Okay, we'll be glad to.
Yes.
Because I just don't want to I want to make sure that it doesn't fall through the cracks. I just want to know if they've made their improvements and we don't have any more problems, or whether they followed up with the city to find out what their concerns have been, especially with respect to the inability to compete. I mean, do some of the work that needed to be done according to the concerns.
So to be clear, the Epic is in the process of being implemented as a system.
That's right. I was just asking about. That's why I was just asking.
Right, and so I think the don't hold me to this date, but I believe the approximate or the estimated go live date would be March or so of next year.
That's right.
So, and I think you had a question regarding about interconnectivity.
That's exactly right.
And I think community care had addressed that to a large degree about having interconnectivity to, within their, that Epic system has a lot of different modules, and the ability to communicate with those modules. It gets a little more challenging with additional systems, both on the kind of the data relationship and the HIPAA privacy issues. So that would be a lot more challenging in that regard. So for example, and you may tell me if I'm mischaracterizing this, but for example, the city just implemented a Salesforce.com system related around contact tracing, and it's very difficult on some of those systems to, especially on the onset, to have other types of systems interface or communicate and trade data within those different systems.
Like from other doctors' offices or other providers.
Yes, that's correct.
That was a concern, and I just wanted to know. I get it's a moot point, I guess, but when we do evaluate implementation of these big investments on projects like this, are those things not taken into consideration, or they must have resolved them, I'm assuming, and it wasn't a consideration?
Well, no, I think they are, and I think there are considerations around what modules and functionality do you have within a system, so that you're not, it's a more of an integrated system that can trade data amongst all those functionalities, rather than having disparate systems for each.
That's right.
Function. And then you have to build all of that data exchange. And
that's right.
Quite frankly, you'll pay more for an integrated system, but you'll probably have a lot more data reliability
in the long run.
In the long run, and I think that's the direction that that was taken along the evaluation and eventual decision for Epic.
Thank you, Jeff. I appreciate that answer.
Thank you.
Just real quickly on the 13 business cases that have been implemented into the budget, can you give us a listing?
Yeah,
yes, Lisa had a summary table.
If she can just send it to me.
Okay.
Because I haven't seen a listing. Okay. And then also when we're getting when we're having the community conversations and we're having people fill out cards, if they're doing it online or if they're going to do it in person, with respect to testimony or input on our budget, can we ask a question as to whether or not they're currently getting money from Central Health or one of our enterprise members or not? Are they they're a public citizen talking about what they'd like to see happen in our budget, what they'd like to, what their concerns are, or whether or not they're just advocating for continued contracts?
So I think what you're suggesting is
Mike, do you
similar.
understand what I'm saying?
I think so, but let me say this back just to make sure that I'm understanding, but it would be similar to legislative testimony where you ask people, who do you represent? Are you representing yourself or an entity?
Are you getting funded or not? Are you just here as a public citizen? Yeah.
Yeah, let me circle back around with the comms team. You know, we don't want to discourage anybody from participating, but I think to be able to, you know, have some insight into, you know, who is talking, you know, is certainly worthwhile. But let me circle back around with them on that. I don't have a good answer for you right now.
I mean, that is not anything to be ashamed of. Okay, working with Central Health is a good deal. So that just so we have an idea as to.
Well, we like to think so. Yeah.
Well, that's right. That's right. Are we dealing with provider input or are we dealing with community? I mean, real people.
Or taxpayers.
Taxpayer input.
Right.
That's right. Everybody's a taxpayer.
No, not everybody.
Oh yeah. So if they buy anything.
Okay, so
awesome,
members, are there other questions before we conclude this item?
Thank you.
Thank you. I'm not seeing any, so please, if you have them, shout out now. If not, we will move on to item number 6. All right, hearing none, we will move to item number 6, confirm the next regular board meeting date, time, and location. Managers, our next regularly scheduled Central Health Board of Managers meeting is tentatively scheduled for Wednesday, August 26, 2020 at 5:30 p.m. at the Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 7872, and/or remotely by video conference, depending on the status of the governor's disaster declaration and stay-at-home orders. Is there a motion at this time, members?
I move adjournment.
Okay, is there a second? Manager Bell has moved adjournment. I see Manager Valadez waving for a second. Manager Valadez, do you second that?
Second, please.
Okay, all in favor? Aye.
Aye.
Opposed, same sign. Any abstentions? We are adjourned. Thank you, everyone who's joined us. Thank you very much.
Members.
Thank you.
Thank you. Bye.
Thank you, everybody.
Thank you.
Thank you.